Good evening, everyone. So, today we will be discussing the difference between primary and permanent teeth. So, let's start our class with So, we're going to talk about the differences between primary and permanent teeth, maybe some similarities and differences, right? So, we should not call it primary and permanent, rather we should call it primary versus permanent teeth, right? So, let's begin with the development. Let's begin with the development. So, when I say development, you know that everything it starts from a primary developmental center, right? So the developmental center of a tooth is known as lobe, right? So the question is, how many lobes does it take to form a tooth? How many lobes does it take to form a tooth? So in case of primaries, the incisors, they are unique, and it is said that they are made up of only one lobe. Now when you compare it to permanent, teeth, the permanent incisors, or in fact all the anteriors, are made up of at least 4 lobes. So the first difference is that the minimum number of lobes needed to form a tooth would be 1, and that is a primary tooth, which is incisor. But the minimum number of lobes required to form a permanent tooth is 4, right? So all the anteriors and the premolars and the second molars, right, they are made up of 4 lobes. So the only teeth which are made up of 5 lobes, in case of permanent, 4 lobes is minimum, and 5 lobes, they will make up the first molars, and the third molar, which has 5 cusps, and mandibular second premolar, which has 3 cusps. So these are the 3 teeth which are made up of 5 lobes. Also we can say the third molar, which has only 4 cusps, right? 4 cusps or 3 cusps, all those third molars are derived from 4 cusps, right? So in case of permanent, as you can see, minimum 4 lobes are needed to form a tooth, and maximum is 5 lobes. In case of primary, the minimum number is 1 lobe. Now, the thing is that with the recent advancing knowledge, we know that this might not be correct. See, why did we say that it is made up of 1 lobe? Because the primary incisors, they lack mamelons. Right? They lack mamelons, and that's why we said that they are made up of just 1 lobe. So, what about the other teeth? Just like the permanent, the primary canine and first molars, they are made up of 4 lobes, whereas the second molars, they are made up of 5, or they are made by 5 lobes. So this is the first difference and the similarities, right? So canines in permanent and in primary are both made up of 4 lobes, but the second molars in case of primaries are made up of 5 lobes, but in case of permanent, the second molars are usually made up of 4 lobes. Since the second molars, they have just 4 cusps, right? So this was about the development. After that, the chronological stages that we have already studied in the previous class, right? So I'm just going to brush on it. So we have seen in the previous class that prenatal development is for the primary teeth, Whereas the permanent teeth, they all show postnatal, that is, they are initiated postnatally, right? So permanent teeth are initiated postnatally, whereas primary teeth they are initiated prenatally, right? Except for the permanent first molar, right? Except permanent first molars. Now we know permanent first molars, they are initiated at the time of birth, and that's why they have the neonatal line, unlike the other permanent teeth, isn't it? What else can you say? The primary teeth, they are completed by 30 months of age, right? So all the primary teeth have erupted into the oral cavity by the age of approximately 30 months, isn't it? And what about the permanents? What about the permanents? The permanent teeth, they start erupting at 6 years of age. And if we are not considering the third molars, all permanent except third molars erupt by 13 years of age, right? So there is a difference in the eruption. This was some information about the eruption that we have already studied, right? Chronological staging or chronological stages that we have already studied. So we don't need to go through it again. So next, let's talk about the hard tissues that make up these teeth, right? So let's start with enamel. So as far as the enamel is concerned, what is the difference or similarities between primary and permanent teeth, right? So in case of primaries, the enamel layer is thin, right? It is thin. So if we say, let's say if we are drawing a tooth, a primary tooth, what we'll notice is that the thickness of enamel, let's say this is the enamel, right? The thickness of enamel as compared to the permanent tooth, is thin. Also, the other thing that you would notice is that in case of permanent, the thickness is variable, right? Unlike primary, the thickness is variable. So in case of primary, the thickness is 1.5 millimeters approximately throughout, whereas in case of permanent teeth, minimum thickness is at the gingival margin, right? This is the gingival margin, and we have the minimal thickness of enamel at this point. So minimal thickness is at cervical margin, and how much is it? It is approximately 0.7 millimeters, whereas maximum thickness is at cusp tips, right? Cusp tips or incisal edges. And how much is it? Approximately 2.5 millimeters. Also, we have studied in one of the classes where we talked about enamel, where we discussed the properties of enamel, that the guiding cusp has greater thickness of enamel as compared the guiding cusp has lesser thickness of enamel as compared to the supporting cusp, right? So supporting cusp has greater thickness of enamel, and that is true for both primary and permanent. So this is one of the points which is similar or same in both primary and permanent dentition, right? So this was about the thickness. Next, about the mineralization. So thickness is more in permanent dentition and it is variable in permanent dentition, whereas it is uniform and it is less in the primary dentition. Now mineralization. So what do you think about the mineralization of enamel in primary as compared to that of permanent? Do you think there is a difference or do you think they both are same? So what do you think should happen? So in case of primary, mineral content is less as compared to permanent enamel, right? So which of the two do you think would be more translucent? See, the translucency increases with increase in mineralization, right? So since permanent teeth are more mineralized, the permanent enamel is more translucent, right? So in which of these two underlying dentin will show more? Where more of underlying dentin would be visible? So underlying dentin is more visible in permanent dentition. So with this I am coming to the color of the tooth, isn't it? So what would be the color of enamel? What would be the color of enamel in primary and in permanent? Since the permanent tooth is more translucent, right? The permanent tooth is more translucent. Underlying dentin, which is yellowish in color, would be visible. Whereas in case of primary, it is less mineralized, so it is more opaque. So underlying dentin would not be as visible, and therefore the primary dentition would appear china white. Whereas in case of permanent teeth, the enamel or the crown would appear yellowish white, right? The permanent tooth would appear yellowish white. So what else do you think would happen because of this decreased or because of this less mineralization of primary tooth? So because of the less mineralization of primary tooth, if we are talking about clinical relevance, then primary, since it is less mineralized, or you can say it has more organic content, so what happens is it will take greater time for etching, right? So demineralization के लिए हमें ज़्यादा समय चाहिए, etching के लिए हमें ज़्यादा समय चाहिए primary dentition के अंदर as compared to the permanent dentition. Is it clear? So that's one of the clinical significance. What other clinical significance can we think of? Since it is less mineralized, primary dentition, it undergoes attrition or abrasion faster as compared to permanent dentition, right? So as compared to the permanent dentition, they would abrade at a quicker pace. They would undergo attrition at a quicker pace, right? So this is about the mineralization. Then next, if we go to its microscopic properties, the direction of enamel rods. The direction of enamel rods. So we have seen in one of the classes on enamel that usually what happens is, let's say this is the permanent dentin and this is the primary dentin. On this we have the enamel, right? This is the enamel. So what we have seen is that in case of primaries, all the enamel rods are occlusally directed, right? All the enamel rods are occlusally directed. And same is true for the permanent enamel, isn't it? Same is true for the permanent enamel. All the occlusal rods are directed, all the rods, enamel rods are directed occlusally. Then what's the difference? The difference is in the exception. So what is the exception? The exception is the cervical enamel rods in the permanent dentition. The cervical enamel rods in the permanent dentition are directed cervically, right? So this particular portion, as you can see here, the enamel rods are directed cervically as compared to the primary dentition where the cervical enamel rods are directed occlusally. So in general, we can say that all the enamel rods are directed occlusally, but in case of permanent, the cervical rods, they are directed cervically, right? So this is one difference that we need to remember. But despite this difference, can we say, in general, the enamel rods have a tendency to move towards the occlusal surface, right? We can say that, right? The enamel rods, they have a tendency to be directed occlusally as they move out from dentino-enamel junction. So what is the exception? The exception is at the cervical margin. So what is the exception? The cervical rods in permanent enamel which are directed cervically, right? So this is the exception, not the rule. Is it clear? So this was about the enamel, its thickness, its color, its mineralization, right? And we discussed a couple of clinical relevance based on those. And what about the dentino-enamel junction? Do you think there would be a difference in the dentino-enamel junction of primary and permanent? Do you think there would be a difference between the dentino-enamel junction of primary and permanent? So we know that the DEJ is usually scalloped, isn't it? That is what we have studied. That dentino-enamel junction is scalloped. So do you think it would be scalloped in both primary and permanent? And the answer is no. Right? It is scalloped only in permanent dentition, whereas the DEJ is smooth. In primary dentition, right? So in case of primary dentition, in case of primary dentition, the DEJ is smooth, but in case of permanent dentition, the DEJ is scalloped, right? It is scalloped. Clear? So, if the DEJ is scalloped in permanent and is smooth in primary, what about the cemento-dentinal junction? What about the cemento-dentinal junction? Now, since we are discussing the junctions, the dentino-enamel junction, let's discuss the cemento-dentinal junction here as well. The cemento-dentinal junction, right? So this junction between cementum and dentine, let's say this is the root, then over it we have cementum, isn't it? So the root or the dentine surface of the root is covered by cementum. So what can we say about this junction? junction between dentine and cementum. Now dentine and cementum, the junction is smooth, unlike the dentino-enamel junction. So do you think it is smooth in both primary and permanent? And the answer would be no. It is not smooth in both primary and permanent. It is smooth in permanent teeth, whereas it is scalloped in case of primary teeth. So as you can see, the junctions, they are reversed in both primary and permanent. The DEJ is scalloped in permanent and cemento-dentinal junction is scalloped in primary. The DEJ is smooth in primary and the CDJ, that is cemento-dentinal junction, is smooth in permanent. Clear? So please keep this in mind. Cemento-dentinal junction and cemento-dentinal junction and dentino-enamel junction. So this was about the enamel. Now let's go to the dentine. So do you think there is a difference in the dentine between primary and permanent? Which of the two do you think forms at a rapid pace? Which of the two do you think forms at a rapid pace? Between the primary and permanent, which dentine forms faster? So the permanent dentine forms faster than primary dentine, and we have seen that the pace of formation of permanent dentine is approximately 4 microns per day. And we haven't seen that. We haven't done any discussion on dentine, right? We have done a discussion on enamel, sorry. But the pace, the daily rate of deposition of dentine is same as enamel, and it is approximately 4 microns per day. Enamel also forms at the pace of 4 microns per day. And same as dentine, the permanent enamel forms faster as compared to the primary enamel. Clear? Now, since we have talked about the formation, the rate of formation, I also want to mention something about enamel. We have studied about the cross striations. So we'll come back to dentine again. Let's go to enamel once more. You have studied the cross striations, right? The incremental lines, and then we had studied about the stria of Radiologist, and then neonatal line. So all these are incremental lines, isn't it? So where do you think more of incremental lines would be seen? In the primary dentition or in the permanent dentition? In the primary enamel or in the permanent enamel? So which of these three is easily visible from the surface? It is the stria of Radiologist. So a stria of Radiologist is visible on surface in form of perikymeta, isn't it? And perikymeta, let's say this is an incisor, and we know that perikymeta, as we move towards the cervical margin, their number increases and also their density increases, right? They are very few on the incisal third or on the occlusal third or on the cusp tip, right? So basically, as we go towards the occlusion or towards the incisal edge, the number of perikymeta decreases, right? And it increases towards the cervical margin. In case of primary, the number of perikymeta is negligible, right? So this perikymeta is negligible or absent in primary dentition, right? So perikymeta is a feature of permanent teeth. It is rarely seen on primaries. It is rarely seen on primaries, right? So this was about the incremental lines. Now let's come back to dentine. So I had told you that dentine forms at a rapid pace in permanent as compared to primary teeth, isn't it? So this is what I have told you. So now where would more of dentine would be seen? where more of dentine would be seen. So there are not many differences between primary and permanent. So more or bulk would be seen in permanent as compared to the primary. Dentinal tubules, where do you think there would be more regular as compared between the primary and permanent? They are more regular in primary as compared to the permanent dentition. Now when it comes to accessory canals and lateral canals, right? Accessory canals and lateral canals, they are both seen traveling through the dentine, isn't it? Accessory canals and lateral canals. Now I'm not including those in pulp, instead I am including those in dentine. So accessory canals and lateral canals. Now what is the difference between accessory and lateral canals? Usually we combine them under one heading and we call them lateral canals, but they are different. And how are they different? Let's say this is the root, right? And this is the dentine. So this is all dentine. Isn't it? So what is the difference between the accessory and lateral canals? Lateral canals, as the name implies, they would be seen traveling lateral to the main pulp canal, isn't it? They would be seen traveling lateral to the main pulp canal, whereas the accessory canals, they would be seen traveling parallel, almost parallel to the main pulp canal, right? So these are the accessory canals which are usually seen in the furcation area, right? They are usually seen in the furcation area, and these are the lateral canals. So these are all the lateral canals, and they are often seen in the apical third, where they would even form the apical delta. So if you take a look at this region, the apical third region, how could it appear? So it would appear something like this, isn't it? So this is the canal, this is the main pulp canal, and here this is the lateral canal. So as you can see, because of the formation of this lateral canal, a delta of dentine is present between this lateral canal and the main canal. So that's why it is known as apical delta. It's present at the apex. So usually these lateral canals are found close to the apical third, right? And in case of primaries, there are more accessory as compared to the permanent, but in case of permanent, there are more lateral canals as compared to the primary tooth, right? So in case of primaries, there are more accessory. In case of permanents, there are more lateral canals. So if we combine these both, accessory plus lateral canals, then these are found more in permanent tooth as compared to the primary tooth. Clear? So the sum total of lateral plus accessory is more in permanent teeth as compared to the primary teeth or primary dentition. Clear? But if you are asked simply about the accessory canals, they are more in primary dentition, right? And because of this greater number of accessory canals, so because of this greater number of accessory canals, the furcation area is more commonly and rapidly involved in primary dentition in case of caries. So when the caries reach pulp, as compared to the permanent dentition, in primary dentition, the furcation is more readily involved, right? Because of these accessory canals. So furcation is more commonly involved in primary dentition as compared to the permanent dentition, and all thanks to these accessory canals, right? So the thickness of dentition is less in primary, it is more in permanent, and same as enamel, they are less mineralized in primary, more mineralized in permanent. So dentine is less mineralized in primaries. So mineralization same as enamel. Enamel, it is more in permanent as compared to the primaries. So dentine is more mineralized in permanent dentition. Now let's go to the cementum. Now just like the other hard tissue, cementum again is thinner in case of primaries, it is thicker in case of permanent dentition because it keeps on forming throughout the life. So more of secondary cementum, right? More of secondary cementum. Where would it be found? In primary or in permanent? Since the secondary cementum forms throughout the life, right? And more of time is available with permanent dentition. So more of secondary cementum would be found on permanent dentition. So secondary cementum, this is the major difference, right? So that's why I'm not talking about the primary cementum, I'm just talking about the permanent cementum. So permanent cementum is basically found more on permanent as compared to the primary cementum. Primary dentition. I should not write these numbers because you might get confused between secondary cementum and those things. So permanent dentition में ज़्यादा secondary cementum होगा as compared to the primary dentition. Is it clear? Do you want to ask anything up till here? Cemento-dental junction हम already discuss कर चुके हैं, right? So अभी तक कुछ पूछना है? अगर नहीं पूछना तो हम आगे बढ़ते हैं, ठीक है? तो ये हमने टिश्यूज की बात की अभी तक. दूसरा लास्ट टिश्यू कौन सा बचा? पल्प. So do you think there would be a difference between the permanent and primary pulp? So usually there is not much of difference between primary and permanent pulp, but the first difference that you would notice is duration, right, or the life of the pulp. So primary pulp has a lesser life or a limited life. So on an average, it has a life of approximately 8.6 years. It has an average life of approximately 8.6 years. But the permanent pulp, it is present as long as the tooth is vital, right? In case of permanent, this is the primary. In case of permanent, the pulp is alive till the tooth is vital, right? That is till the caries have penetrated into the pulp or the tooth is lost. So till the tooth is vital, the pulp is alive, right? So apart from that, majorly it is same. The permanent and the primary pulp, they are same. The difference is in the pulp chamber or in the pulp canal, right? So we'll come to that. So till now we were talking about the tissue. Now let's talk about the crown and the root and the pulp chamber, right? So what differences do you think are present in the crown? So when we talk about the crown, let's first draw the crown. This is the permanent tooth or the permanent crown, and this is the primary crown, right? So when you look at the permanent crown and primary crown, which of these two would appear bulkier? Which of these two would appear bulkier? The permanent is bulkier as compared to the primary, right? And when you look at their surfaces, the permanent tooth appears to have a curve, whereas the primary tooth just above their cervical ridge. This is the cervical ridge. So above the cervical ridge, the surface is flat, isn't it? So If we are talking about surface, then the primary crown has, we should say smooth, rather we should say straight surface above cervical ridge, whereas the permanent crown has a curved surface, isn't it? So this is true for posteriors. What about the anteriors? What difference can we see in the anteriors? So let's say this is the anterior. And this is another anterior. These are both newly erupted. So can you identify which of these is primary and which of these is permanent? So this is the primary and this is the permanent tooth. So how did we identify which one is which? Based on these structures. So what are these formations? What are these formations on the crown? These are known as mamelons. Right? So mamelons are present in permanent incisors and they are absent in primary. So that is another difference. Now this was about the incisors. The rest all the things are more or less similar, isn't it? Rest all the things are more or less similar. But one difference that we must remember is the upper primary central incisor. This is the only anterior tooth in both primary and permanent. Where mesiodistal dimension is greater than cervico-incisal dimension. So this is an exceptional tooth. And the mesiodistal dimension greater than cervico-incisal dimension, this is the only anterior tooth, right? This is the only anterior tooth. So this is one unique feature that you can remember. Then what else? If we again go back to the permanent dentition, what would we notice? Let's talk about the occlusal surface. So if we talk about the occlusal surface, can we say that the occlusal surface is wider as compared to the occlusal surface of the primary? The occlusal surface on permanent is wider as compared to the occlusal surface of the primary dentition, isn't it? Another thing that you would notice is that these cusps, they are more prominent, or the occlusal anatomy is more prominent on permanent dentition, isn't it? The occlusal table is deep on permanent dentition. So first of all, occlusal surface is wider in permanent dentition and occlusal table is deeper again in permanent dentition. So what does this imply? It implies that the primary cusps are shorter than permanent cusps, right? So primary cusps are shorter as compared to the permanent cusps. So what other feature do we notice in this crown that can differentiate between the two teeth? We can see that the occlusal surface, as the tooth goes towards the occlusal surface, it converges, isn't it? As you can see, there is a convergence in the primary and there is almost a divergence in the permanent, isn't it, as compared to the primary tooth. So that's why we have said that the occlusal surface is wider in permanent and it is narrow in the primaries. What other feature can we say? Can we notice very easily? It is the cervical ridge, isn't it? So cervical ridge is a characteristic feature. So cervical ridge is a characteristic feature of all primary teeth or of primary dentition, isn't it? But it is also seen in permanent molars. Now, since it is the characteristic feature of primaries, obviously it is more prominent in primaries. So this cervical ridge is more prominent in primary dentition, and even in primary dentition it is most prominent in upper and lower first molars, right? And even among these, it is the lower first molar where it is more prominent as compared to the upper first molar. So the most prominent cervical ridge is seen on the lower first molar, and when you look at it from an occlusal view, so this is how the occlusal surface appears, and let's say this is the buccal side, this is the lingual side, this is the distal, and this is the mesial side. So as you can see, the mesiobuccal portion of the cervical ridge is very prominent. It almost appears like a tubercle, right? And that's why it is named as tubercle of Zucker-Candle, right? Now this tubercle of Zucker-Candle is present both in upper and lower first molars, right? It is present in both upper and lower first molars, but it is more prominent on the lower first molar. So this tubercle of Zucker-Candle is unique to primary first molars, right? It is unique to primary first molars, and it is most prominent in the primary mandibular first molar, right? So this is some information about the crowns. Last, the cervical constriction. So when you look at the primary and the permanent dentition, what do we notice? So do you notice a constriction at the cervical margin in both of these teeth, and where is it more pronounced? It is more pronounced in case of primary dentition, isn't it? It is more pronounced in case of primary dentition. So cervical constriction is more pronounced in the primary dentition. And why is the cervical constriction present? The main reason of the presence of the cervical constriction in primaries is this buccal or palatal or lingual cervical ridge. So main reason for the formation of this or the presence of this prominent cervical constriction in primaries is the cervical ridge. Clear? So it is more prominent in the primaries as compared to the permanent. So this was about the crowns. Let's now go to the roots. So when we are talking about roots, as you can see here, in case of primaries, the root trunk is shallow and it is smaller as compared to permanent dentition. In case of primaries, the roots are more divergent as compared to permanent, right? As compared to permanent, the roots are more divergent and they are relatively longer. Now you would ask that the primary teeth are small, then how can the root be longer? So when we say that they are relatively longer, what it means is that, for example, let's say this is the upper central incisor, which is primary, right? This is the primary upper central incisor. Now compare it to the permanent upper central incisor. Compare it to the upper central incisor. Now when you compare it to the upper central incisor, what you would notice is that as compared to the length of the crown, the length of the root is more, isn't it? But in case of permanent, there is not much difference between the length of root and the crown. So relatively, Something happened and the app crashed. Yeah. So relatively, what has happened is, relatively what we can say is that the primary roots are longer than their crowns in primary, right? So the roots are longer in the primaries as compared to their crowns. So we can say that root to crown ratio is greater in primary dentition, isn't it? The root to crown ratio is greater in primary dentition, and that's why we say that the roots are relatively longer in primaries as compared to the permanent, right? They are thin as compared to the permanent. So when we say that they are thin, similar things can be said about the pulp chamber and the pulp canal. The pulp chamber is shallow, and since the dentine and enamel is thinner, it is closer to surface in primary dentition. Also, the pulp canal or the root canals, right? The root canals or the pulp canals, they are thin. They are thin in primary dentition. Clear? So the pulp chamber is broad and it is shallow in the primary dentition. You can also write that it is shallow and broad and closer to the surface in the primary dentition, whereas the root canals or the pulp canals, they are thinner in case of primary dentition as compared to the permanent dentition, right? So these are some of the differences between primary and permanent dentitions. If you have any doubt, you can ask me. I didn't talk anything about the resorption, isn't it? There is one more thing. We know that the roots of the posteriors or the anteriors, they bend distally in almost all the anterior teeth, in almost all the permanent dentition, isn't it? So be it lateral incisor or central incisor or canine, right? All of their roots, they bend distally, be it slightly, but yes, they do bend. Obviously, upper central incisor is an exception. So upper central incisor root is almost straight, but apart from that, all the roots, they have a distal bend. In case of primary dentition, apart from the distal bend, the root apex also shows a, so let's say this is the proximal view of a primary root. So apart from the distal bend, it also shows a facial bend, right? And this facial bend is approximately 10 degrees. So all the anterior teeth, they also show a facial bend, right? And it is at approximately 10 degrees. This is for the accommodation of the permanent incisors or permanent canines. Now this bend is for accommodation of permanent or the succedaneous teeth, right? So this was about the pulp chamber and the other things about the primary and permanent dentition. So I was telling about the resorption, right? So I didn't tell you anything about the resorption of the primary dentition. So do you think there is a difference in the tissue itself or the enamel or dentine? And since the root resorbs, let's say the dentine and the cementum, do you think there is a difference in the dentine and cementum of primary and permanent, which makes the primaries more resorbable as compared to the permanent dentition? Do you think there is a difference in the tissue? So as far as the resorption is concerned, there is no difference between primary and permanent dentition. The cementum and dentine are same. The pulp is same, everything is same. So what is the difference? The difference is in the genetic programming. These teeth are genetically programmed to resorb. So basically, what happens is it is the recruitment of odontoclasts. So odontoclasts are these main cells which are responsible for the resorption of the tooth, and it is the recruitment of odontoclasts, right, which makes the resorption possible. So if the odontoclasts are recruited for the permanent dentition, even the permanent dentition roots will resorb, and that has happened, right? We have studied in the BDS that there is external root resorption or there is internal root resorption even in case of permanent dentition. So it all depends on the recruitment of odontoclasts. So usually the odontoclasts are not recruited for permanent, but they are recruited for primary at a certain age. So it is the odontoclast, recruitment of odontoclasts, that is the only difference between primary and permanent dentition. There is no difference in the tissue. The only difference is in the genetic programming. The odontoclasts are programmed to appear once the time of resorption has arrived, right? So these were some of the differences or similarities between the primary and permanent dentition. Now based on that, I have some MCQs. Let's go to those MCQs. So these are some of the MCQs. Which are the following features? Which of the following features is most characteristic of primary molars? So which of these is most characteristic of primary molars? Tall cusps with well-defined occlusal anatomy that we have already studied is a feature of permanent dentition. Wide root trunks. The root trunks are narrow, right? The pulp chambers are broad and shallow. But as I have told you, the root trunks are smaller, they are shorter, right? Narrow cervical constriction. Divergent roots to accommodate developing premolars. So obviously, premolars are the succedaneous tooth and the roots are divergent to accommodate the premolars. So option D is the correct answer here, isn't it? The roots are divergent so they can accommodate the developing premolar. The enamel rods in the cervical region of primary teeth will slope. So where do they slope? We have already seen it here, right? That all the enamel rods, they have a tendency to be directed towards occlusal surface except for the cervical rods of the permanent dentition, isn't it? And here in the question we are talking about the primary. So the general rule will apply and the correct answer would be occlusal, right? All the enamel rods are directed occlusally, even the cervical rods of enamel. Cervical rods of primary dentition. Which of the following is true about the pulp chamber in primary teeth? It is large and closer to the outer surface. It is located more apically. This is incorrect. Smaller than the permanent teeth. It might be correct. It is less vascular. Again, this is incorrect. Right? So, do you think it is larger and closer to the outer surface? Now, when you consider the thickness of the hard tissues, right? It is shallow. It is broad. But since the thickness of the hard tissue covering this pulp is lesser in case of primaries as compared to the permanent, it relatively appears to be larger than the permanent dentition. So when we say larger, basically we are comparing it to something. So what are we comparing it to? We are comparing it to the permanent pulp chamber. The permanent tooth, it has thicker dentine, right? It has thicker dentine covering the pulp chamber. So that's why it appears relatively smaller in case as compared to the primary. So the primary dentition, it has larger pulp chamber, and since the tissue covering it is thin, it is also closer to the outer surface. So option A is correct, right? So let's go to the next question. The primary dentition is usually completed by, this again we have discussed in the class, it completes by approximately 30 months. All the primary teeth are erupted by 30th month, right? The cervical bulge is most prominent in which region of primary dentition or primary tooth? Now again we have discussed it when we are talking about the tubercle of Zuckerkandl. So when we discuss the tubercle of Zuckerkandl, where was it more commonly found, or where was the cervical bulge more prominent? It was most prominent on the mesiobuccal surface, right? So we can say that the most prominent cervical ridge is seen on the buccal cervical thread. सर्वाइकल रीजन तो सर्वाइकल थ्रेड में ही होगी, that is given. So even if you did not have these two words, you would still go with buccal, right? The color of permanent teeth compared to the primary teeth is usually, so as we have discussed here, that the permanent enamel is more translucent, it is more mineralized, so more of underlying dentine is visible, and that's why it would appear more yellowish, right? Which of the following is more prone to early attrition? Early attrition, we have discussed this as well. Since the primary dentition is less mineralized, it is more prone to undergo attrition or abrasion, right? So, permanent incisors, permanent molars, primary canines, and primary molars. So, which of these two do you think would readily undergo attrition? Is it primary canines or is it primary molars? Now, when it is a comparison between canines and molars, obviously the occlusal forces are greater on the molars. So, more of attrition would be associated with the molars, be it primary or the permanent, right? So, in case of permanent teeth, more attrition is seen in the posteriors, isn't it? So, even in primaries, more of attrition would be seen in posteriors. Which of the following is not a difference between primary and permanent teeth? So, which is not a difference? Primary teeth have a thinner enamel, yes, this is correct. Primary teeth have relatively longer roots, this too is correct. Primary teeth have pronounced cervical constriction, this is correct. Primary molars resemble permanent premolars. So, do you think all the permanent molars resemble all the primary molars resemble permanent premolars? Why do we have this word permanent here? Premolars are not present in primaries. So, even if we had the word premolar, it would still imply that the teeth are permanent, right? So, primary molars resemble premolars. And this statement is incorrect. Now, why is it incorrect? Because apart from the maxillary first molar, none of the other primary molars resembles any premolar. So, upper D is the only tooth that resembles a premolar, right? So, upper D resembles the upper first premolar, but none of the other teeth or none of the other molars resembles any premolar. So, this statement is incorrect, right? And hence, this would be the answer. Now, you might say that it is partially correct, but then again, when we are solving MCQs, we are not aiming to find the correct answer. We are aiming to find the best option. Now, amongst these four, the best option would be option D, right? It might be partially correct, but then it is partially incorrect as well, isn't it? So, that's why option D is the best option here. The roots of primary molars begin to resolve approximately. So, all the roots, they begin to resolve approximately 1 year before their exfoliation. So, here option C is the correct answer, right? Approximately 1 year after 1 year before the exfoliation. Which of the following statements is true about primary canines? Did we miss question 9? No, we didn't. So, which of the following statements is true about primary canines? They have wider crowns than permanent canines. This is incorrect. They erupt after the first molars. Let's leave it for now. They are usually the last to exfoliate. This is correct. They are replaced by permanent molars. This is incorrect. Right? So, do you think the primary canines are last to exfoliate, or do you think they erupt before after the first molars? Now, sometimes we get confused with this third statement. Why do we get confused with this third statement? Because there is a general statement which says that canines are the last teeth to be replaced. And this statement is absolutely true, right? So, when we say that the canine are the last teeth to be replaced, we automatically think that they are the last teeth to exfoliate, but that is not true. The last teeth to exfoliate are primary, second molars. Then, how are these two statements true? That the primary, second molars are last teeth to exfoliate, whereas the canines are the last teeth to be replaced. What it means is that though the second molars exfoliate after primary canines. The permanent maxillary canine is the last subcutaneous tooth to erupt, isn't it? And until upper 3 or the upper canine has erupted, not all the primary teeth have been replaced. Now, when you say replaced, that means one exfoliates and the other tooth erupts. So, unless it erupts, you cannot say that it has been replaced, right? So, maxillary canine erupts after all the other subcutaneous teeth. We have studied it when we were discussing about the chronology of dentition, right? You might remember that all the mandibular teeth erupt before maxillary teeth, except for the maxillary premolars, which erupt before mandibular premolars. So, what was the sequence? The sequence was lower canine, then upper first premolar, lower first premolar, upper second premolar, lower second premolar, and then finally the upper canine. So, upper canine is the last tooth to erupt, and that's why this confusion is there, right? But both these statements are true. The second molars are last to exfoliate and canines are last to be replaced, because the maxillary canine is the last subcutaneous tooth to erupt, and hence the answer here would be option B. That is, they erupt after first molars, isn't it? We have studied this in chronology. Which of the following teeth shows the least morphological resemblance between primary and permanent counterparts? So, resemblance between permanent and primary counterparts is least. Options are central incisors. So, central incisors, primary and permanent central incisors, they appear almost identical. Not exactly, but almost identical. Canines are also almost identical, right? Maxillary first premolar and mandibular first premolar. Now, maxillary first premolar, we have said that it almost resembles first premolar, whereas the mandibular first molar is an atypical tooth. It does not resemble any tooth, right? So, upper D resembles a premolar and lower D does not resemble any tooth. So, which of these two do you think would be the correct answer? And you might be inclined to choose option D as your correct answer, but then you would be wrong. Why? Because the general shape of the lower first molar, right? The general shape of the lower first molar resembles that of a molar. So, the general shape, it resembles that of a molar, right? Whereas the general shape of an upper first molar, the general shape of the upper first molar it resembles more or less to a premolar. So basically the difference is that the lower D, it resembles a tooth of its same class. It resembles its counterpart. Now the counterpart is not the subcutaneous tooth. The subcutaneous tooth is premolar. The counterpart is molar. So a molar is the counterpart of a molar, and we are here comparing two counterparts. So if we have to compare the first molar, we need to compare it to the molars. If we need to compare the anteriors, we need to compare them with anteriors. So those are the counterparts, right? So don't confuse the counterparts with subcutaneous teeth. And here the upper D must have resembled a molar, since it is a molar, but it does not resemble a molar, it resembles a premolar. So it is the tooth that least resembles its counterpart, not the lower D. And hence the answer here would be maxillary first molar. So always remember that. Though it is not as atypical as the lower first molar, yet it does not resemble its counterpart, right? Which of the following is absent in primary teeth but present in permanent teeth. So which is absent in primary and present in permanent. So obviously the answer would be mamelons. Mamelons are present in permanent, absent in primary, right? Which of the following is best method to differentiate? Best method to differentiate between a primary from a permanent molar on radiograph. So you are taking a look at these teeth on radiograph. Pulp size would be seen, enamel thickness would be seen, crown length would be seen, and root divergence would be seen. So which of these do you think you would observe most quickly, right? On the first sight, you would notice which of these four traits, and the correct answer would be root divergence. The crown length would be different, the enamel thickness would be different, the pulp size would be different, but it is the root divergence which is most prominent, isn't it? The diverging roots, they are quite easily visible as compared to the not so divergent roots, isn't it? Question 14. The number of, so again, all the options are correct here. So when you are solving an MCQ, it is not the question of finding the correct answer. It is always which is the best option. And amongst these four, the best option is option D, right? I'm not saying that this is the correct answer because all of these are correct. If you have sufficient time based on the pulp size or on enamel thickness or on crown length, you can differentiate between the primary and permanent. But which is the quickest method? The quickest method would be to look at the root divergence. Had there been root resorption? Maybe based on the timing, but again, right, we don't know when the X-ray was taken. So even better than resorption would be root divergence. Clear? So the number of lobes forming a primary molar is, so as we have seen in the beginning of today's session, the molars are either formed from 4 or 5 lobes. So if it's a 5-cusp molar, that is the second molar, it would be made from 5 lobes, and if it is a 4-cusp molar, that is the first molars, they would be derived from 4 lobes. So last question of today. Compared to primary teeth, permanent teeth generally have narrow roots, more prominent cervical ridge, greater mineral content, and lesser surface area. So which of these four do you think is correct? Obviously narrow roots are a feature of primary. Cervical ridge again are a characteristic feature of primary. Since the primaries are smaller overall, their surface area would be lesser. So the correct answer here would be option C, greater mineral content. We have already studied it, right? Enamel, denti, they are more mineralized and permanent as compared to the primaries. So this was all for today's session. Do you have any doubt? If you have any doubt, you can ask me, right? So all the best. Good night.